Hi friends, today's our topic is the nose. So, nose we will read in the two portions, part 1 and the part 2. In the part 1 we will see the external features and the skeletal, framework. It's formed by the bony and the cartilage part we will discuss. And nasal septum and the clinical things, These all things we will discuss in the part 1, and it's part 2. The very important thing is the lateral wall of the nose. That is a very important thing, and that we will discuss in the part 2. So what all are the important things in the nose? Examiner can ask questions from the first thing is the nasal septum, which we are going to cover in this video only, and second is the lateral wall of the nose. These both are the very important things, and you should be thorough with these things, these both things. So now we are starting with normal things, and that is the external features and all. See, nose is the projected and the prominent structure on the face. And what is the function of the nose is in the respirations. It protects the lower respiratory tract. It has organ of the smell. It's responsible for the smell. So these all are the functions of the nose. So now we are going to see first of all the external features. In the external feature, first of all, this is the nose. This is the tip of the nose, which is the free mobile part, and this portion is the root of the nose. And between the tip and the root, that is called dorsum. See here, this is the diagram. This is the tip of the nose. Here is the tip of the nose. This thing is the root of the nose. And area between tip and the root, that is called dorsum of the nose. And this is the columella, and this is the ala of the nose. This thing is the ala of the nose. Right? This is the ala of the nose. And there will be one nasal septum, which divide. There is two nostril, and between that there is one nasal septum. So this is the external things: tip, root, dorsum, ala, and the nostril. Now we have to in the skeleton we have to see one thing, that is in the skeleton. What we have to see, this nose. This nose is formed by two parts. One is the cartilage part, and second is the bony part. See, this part is the movable part, right? So this is formed by the cartilage, and this part is the bony part, right? So this skeleton is the skeleton of this nose. It's formed by cartilage part and the bony part. Cartilage and from bony. So how many cartilage is there in the nose? The answer is the 5 cartilage which is present in the nose. Total 5 cartilage. See here, this is the nose, right? So from here, 2 lateral cartilage. One is this, second is this. 2. Third thing is the alar cartilage, both sides. So 4, and one is this nasal septum. So there is one cartilage that is called septal cartilage. So total 5 cartilage. So 2 is the lateral nasal cartilage, and 2 is the alar cartilage, major alar cartilage. There is some minor alar cartilage also there, and 4, and one thing is the last one is the septal cartilage. So this 2, and 1. So these all are the 5 cartilage. Now bony part. So before going on the bony part, you have a look here. This is the diagram of the nose. This is the lateral view. This is the lateral view of the nose. So see, first of all, this is the nasal bone. So nasal bone, and this is the frontal process of the maxilla. These two are the bone. This is the lateral nasal cartilage. This is the lateral nasal cartilage, no, which is here. This side, lateral nasal cartilage. After that, major alar cartilage. This is from here, major alar cartilage. And this is the lesser alar cartilage. And there will be some fat, that is fibrofatty tissue of the ala. Fibrofatty tissue of the ala. So this is the one side diagram, right? This is the lateral diagram. So one is here, second is here. So two is opposite. So 4 and 1 is between that nasal septal cartilage. So totally 5 cartilage. Okay. So this cartilage over. Now bony part. So bony part here, bony part. So this nose is formed by, one thing is this nasal bone and second is the frontal process of the maxilla. So two nasal bone and one is this frontal process of maxilla. Frontal process of maxilla. See, this is the vertical diagram. This is the vertical view. This is the lateral view. This is the anterior view. You can tell this is the anterior view. So see here. This is the nasal bone. Am I right? This is the nasal bone. So this is the nasal bone, and this side, this is the nasal bone. So two nasal bone. So there is the two nasal bone, and one thing is this frontal process of the maxilla. So here is the frontal process of the maxilla. So total bony, there is 3 bone in the number and 2 types. So 2 nasal bone and 1 is the frontal process of the maxilla. Cartilage, 5 cartilage. Now we have to know one thing, that the bony part is formed only 1/3 and this cartilage part is formed 2/3 part of the nose. So this 2/3 part of this part, anterior part you can tell, and the bony part is the 1/3. Can you remember eustachian tube? In the eustachian tube, what I told you, I told you like this is the eustachian tube, right? So this is the large part, that is the cartilage part, and the cartilage part form 2/3 of the total length of the eustachian tube, and the bony is the only 1/3. Yes, same here. Bony part is 1/3 and the cartilage part is the 2/3. Okay, so this is bony and the bony part and the cartilage part. So the skeletal has oval. Now this lateral alar cartilage, there is bony process. Bone is ending here. Bone is ending here. So after this, piriform apparatus. There is a word, okay, piriform apparatus. What is this? This is nothing. Bone. This starts just after from ending of bone. This nasal bone is ending from here. Okay. So this part is the what? This is the piriform apparatus. So this is what? This is the lateral cartilage, and this is what? Septal cartilage. And here in this region, lateral cartilage and the septal cartilage both are continuous, right? And this is what? This is the major alar cartilage, and this is the lesser alar cartilage. So this is all about the skeleton. Now alar cartilage. See, this is here is the piriform apparatus, maxillary part of the piriform apparatus. So that bony part ending from there is only this piriform apparatus is opening. Starting. So alar cartilage. Alar cartilage is somewhat like this. You can tell like this. Like this. This is the alar cartilage. Or else you can draw like this diagram. Yeah, this is the right only, from here to like this. So this is the lateral crust and this is the medial crust. So this major alar cartilage has 2 parts. One is the medial crust and this is the lateral crust. Okay. Now we are going to see the nasal septum. See, nasal septum is the very important thing. So, examiner can ask what is the blood supply of the nasal septum. Okay, or nasal septum is the short notes for you guys. So, you should be thorough with this nasal septum. So, nasal septum, this is the nasal septum, right? So, this nasal septum is formed by, this is what? This is the sphenoid bone. This is the sphenoid bone. Sphenoid bone. See it. This is the nasal septum. Nasal septum is formed by cartilage part and the bony part. Am I right? So, cartilage part is the first cartilage. That is the septal cartilage. Septal cartilage is here. And this is what? This is the perpendicular plate of the ethmoid. And this is the vomer. And base of the nasal cavity is formed by, base is formed by palate. Palate is somewhat here and nose is here. So nose is going like this. From here to it's going like this. And what is here? That is the palate. So palate and bone is here. Am I right? Now, you have to remember just this thing. If you remember the framework of the this nasal septum, then you can write easily anything. Right? So this septal cartilage is the anteriorly. So this is the situated anteriorly, right? And this is the superiorly and the posteriorly. So this part is superiorly. Superiorly. This vomer, this is the anterior, this is the posterior. So vomer is the posteriorly, and this is the superior. So this is inferior. So inferiorly. So this is the inferiorly. So vomer is the inferiorly. Okay, this is the direction. Now, if you know, this is what? This is the opening of the sphenoidal air sinus, right? This is the nasal bone. We have seen that nose is formed by nasal bone. Okay, from both sides. After that, is maxilla is a part of the maxilla is come and attached to it. So this is the nasal bone, and this all things. This is the nasal septum. Nasal septum is this nasal septum only. Nasal septum is formed by septal cartilage and the perpendicular plate of the ethmoid, and this is the vomer. You just remember this. You can write everything. Come here. What is the blood supply? See, blood supply of the blood supply of the nasal septum. Septum. Am I right? So, roughly I am drawing one diagram. Roughly, this is like this. This is your, here is your palate. Am I right? This is your palate, and here is your sphenoid bone. This is your sphenoid bone. Am I right? Now see, what I said you, this part is the what? Ethmoid. This part is the ethmoid. See here, ethmoid. Right? So, one artery will come from here. One artery will come this. So, what is the name of this artery? This portion is, this part is formed by the ethmoid. Can I tell? Anterior. Ethmoid artery. Anterior ethmoidal artery. One is come from here. That is called what? This is the anterior. This is the posterior. See, formed by the ethmoid. This part is fully formed by the ethmoid. So this is the what? Posterior ethmoidal artery. Am I right? Yes. This is what? This is the sphenoid. I told you sphenoid. From sphenoid to palate. So one artery is called sphenopalatine artery. What is the name? Sphenopalatine artery. Sphenopalatine artery. This is what? This is the palate. So one artery will come from here and it will go like this. So what is the name of this? Greater palatine artery. Great palatine artery. Right? And one will come from here. This is from like this only, no? So which artery is here? That is the facial artery. So one artery is like this. A branch of facial artery, right? So superior superior labial branch of facial artery, superior labial branch of the facial artery. Okay, so this is the blood supply of the nasal septum. See how easy it, ethmoid, so anterior ethmoid, posterior ethmoid. Sphenoid, see this is the palate, so palatine artery. Sphenoid to palate, sphenopalatine artery, and from here is one facial artery, branch of facial artery, that is the superior labial artery. Now, can you see all these arteries? It coming here, right, and it gathered here. So this area is called a little area. Little area. This area is called little area. Now, what is the little area? It's a very, very important thing. The little area is the very, very important. It's very important. What is the little area? Little area present in the anteroinferior. This is the anterior and the inferior. So, and little area is present in the anteroinferior part of the nasal septum, and it's highly vascular. Okay. So, septal branch of the septal branch. This is the septal. So, septal branch of the septal branch of the anterior ethmoid artery, sphenopalatine artery, great palatine artery, and the superior labial artery of the facial now come here and make one anastomosis. That's why it's very highly vascular area. So that is called little area. Now, one thing, if examiner asks Kesselbach's triangle, Kesselbach plexus, not triangle, plexus. Kesselbach plexus. So, same things. If examiner asking epistaxis, what is that? Nose bleeding, right? So, in what happening in the children, it's due to the finger trauma, okay, followed by picking of the nasal septum. So mucous membrane will damage. If once mucous membrane will damage, this artery will damage and no bleeding will occur. That is called epistaxis, nose bleeding. Okay. If examiner asking little area, you have to write whatever I said. What is the Kesselbach plexus? Same thing. And what is the epistaxis? If you want to write epistaxis, you have to draw this diagram. You have to show, like this is the very heavy vascular area. Little area is there, and damage. If little area get damaged, bleeding will occur. That is called epistaxis. So this is the about blood supply of the nasal septum. See here, if you know this framework, you can write everything. Even though you can write arterial supply of the nasal cavity, you can write arterial supply of the lateral wall of the nose. Right now, I am going to rush this. And what is the nerve supply of the nasal septum? Nerve supply of the nasal septum. You should be thorough with this. Okay. So what? Oh. Now supply. Again this is formed by this, right? Here is the palate, and this is your palate, and from here it will come like this, and this is like this, right? So tell me, here is what? Ethmoid. It is formed by ethmoid. So there is one nerve that is called what? This is nerve. This is called anterior ethmoidal nerve. This nasal septum is divided into 4 parts. See here, 4 parts. Okay. If you know direct nerve supply, no problem. If you dividing in this part, it's also no problem. This is the superior part. So this is the superior anterior. So this is antero-superior part. This is the postero-superior part. This is the inferior. So this is the antero-inferior part, and this is the postero-inferior part. So this is supplied by antero-superior part is supplied by anterior ethmoidal nerve. Now you tell me this posterior part is supplied by this. This is supplied by pterygopalatine ganglion. Pterygopalatine ganglion. Pterygopalatine ganglion. Okay. So this is only, you have to remember, this is a ethmoidal nerve, and this both from the pterygopalatine ganglion. From here nasal branch. From here nasal branch of the pterygopalatine ganglion, and this is what? Palate. So nasopalatine, a branch from the nasopalatine from here, see, supplying from only pterygopalatine ganglion, but nasopalatine branch of the pterygopalatine ganglion. So this is the now supply of the these things, okay? And other things, what is the clinical? In the clinical, what we have to write is see a clinical. In the clinical, what? As I told you, nose is the most projected and prominent structure on the face. So nasal fracture. Nasal fracture is the very common. And second thing, this is the nasal septum. So deviated nasal septum, DNS is the very important thing. Deviated nasal septum. Now, deviated nasal septum, well, this is the main cause for the nasal obstruction. Nasal obstruction, and it occurs due to trauma. It occurs due to trauma or developmental error. Okay, if this deviated nasal septum, if it mechanically obstruct this nose, so there will be the problem in the respiration. The respiration problem will be occurs. Okay, so this is about a deviated nasal septum and the nasal fracture. Okay, in the next video we will read the most important thing, that is the lateral wall of the nose. Okay, and that is a very complicated structure. Why that is a very complicated structure? Because there is meatus, there is concha, meatus, openings, everything is there in the lateral wall. So lateral wall is the very, very important. Okay, so in next video we will read the lateral wall of the nose and external feature, these symptoms and everything, skeletal, everything I covered. Okay, so thank you.